My name is James Barclay. I'm a physician assistant here at Ada West Dermatology. I grew up here in the Northwest, been in the Boise area since '94, graduate of Emmett High School locally here. Enjoy everything in the mountains, living out here in the West. Love growing up out here. Went to school at Touro University in Las Vegas, Nevada. Enjoyed it there as well. First job out of school, I worked in family medicine with Dr. Timothy Hodges at Sulcer Medical Group, and did that for about 2.5 years. Enjoyed my time with him, learned a lot, and then I had the opportunity to start in dermatology in 2010 with Dr. Carl Thornfelt, and was out there with him in his practice for about 7 years, and I learned a lot with Dr. Thornfelt. He's kind of a big guru in skin barrier and skin barrier function. He has invented Epionce skincare products, and so I learned a lot with him and enjoyed my time there. Then I was able to go to Delaware and learned a lot out there in Delaware. Saw a lot of different skin types, different skin color, a lot of things that you may not see too much of here in Idaho, but was able to learn and grow out there with my experiences there. And then now I'm here at Ada West Dermatology. Very, very happy here with Dr. Burr and the other providers here. Again, still continuing to learn and grow and have good experiences here at Ada West. The reason why I was really interested in dermatology, so growing up I had bad acne and had to go on Accutane. So kind of got some exposure with that. Dr. Burr was my provider at that time. So just kind of seeing some of the effects of acne, how severe it can be, and some of the treatment options available for it. So that was when I first kind of got a little bit of interest in dermatology. Then in school, some more interest in it. And really kind of the thing that really interested me in dermatology is I found that it was kind of a little bit of almost like a little bit of a detective work, so to speak. You know, you see so many skin things that look very, very similar. So there's small little changes, small little things that differentiate one rash from another. So, you know, it takes a little bit of effort to kind of look closely at the tiny little clues and figure out what the rash could be or what that skin lesion could be. So it's a challenge that way, and I enjoy it. And then the other aspect that I like with dermatology is that there's a lot of surgical procedures and things that you get to do. So I like to do a lot of things with my hands. I like to build things, and so with dermatology you get to do a lot of procedures that's you know, a lot of hands-on things that I like to do. I really like this like feeling of being on a team with people. You interact with a lot of different people. The providers here are really good. If I see something that I'm a little unsure of or have never seen before, I always have access to go grab someone else to get an idea or opinion. We've got some of the brightest physicians here, so you know, being able to rely on other people to get help when you need it is one thing that I really like about Ada West Dermatology. Yeah. There's always advances in, you know, surgical techniques, medications. I'd say psoriasis, you know, we've had developments in new medications for psoriasis that have really helped kind of raise the bar to where people, you know, were maybe getting this clear. Now we're raising that bar to close to 90 to 100% clearing for psoriasis. Atopic dermatitis, a lot of new medications available for those patients as well. And for those patients, you know, having to deal with the disease that can be very itchy, kind of embarrassing for some, to be able to get them clear to where they're happy with their skin, more self-confident those new developments there, I think, are making lifestyle changes for a lot of our patients. I guess one thing patients, I think, if they could understand that, the skin's a very large organ. It's the largest organ of the body. It's very complex. A lot of things can affect it both internally from certain medications, certain illnesses, disease, to external things, the sun, pollution, chemicals that you're coming in contact with. All of those things can affect the skin. And so it's not always very easy or precise when we're making a diagnosis. It may fall into where your skin problem kind of falls into a realm of, well, it could be, one or two or three different types of diseases that's affecting it, and sometimes it takes a long time to work it up and figure it out, figure out exactly what's causing the problem. So it's not always very clear and concise, and it's not very easy. So to stay current in everything going on in dermatology, a lot of journals to follow and read. Conferences are always very exciting, and that's probably where you get most of the up-to-date, most current recommendations is at those conferences. And we're encouraged to try to make a conference every year and stay up to date by reading articles and interacting with our peers. Here in the Boise Valley, we have a Boise Valley Dermatology Society that we meet about every 2 months, and we present cases and interact with our colleagues throughout the valley and continue education that way. So I guess something to look for in your dermatologist is if you feel confident in them. Obviously you have to have a good relationship. I'll be honest with you, I love all of my patients, but I'm obviously not going to be the right person for everybody. So someone that you can trust, someone that you can interact well with, and someone that you have a lot of confidence in. So I like my job a lot, being able to help people. I really enjoy meeting new people, interacting with them. I love hearing stories of their life and their experiences, because in a way I get to learn through them and all the interaction that I have with them. They're teaching me about just life in general and different things that I enjoy to hear. I enjoy to learn about careers, about the world, places to see, places to go, and so I really enjoy interacting with people and learning from them. I love it. I love just hearing about people and where they go, what they've been through. I've had patients that have lived through World War II in Germany, and living through that. So that's amazing. Yeah, it's cool. Very cool. Yeah, everyone. Everyone, I would say, if you have a problem with your skin or something that you're a little concerned about, anyone and everyone can come in and see a dermatologist. We see infants, we see people who are 100 years old. So, if you've got a skin concern or problem, come see us. It may be something that's not serious at all, or it could be something that's life-threatening. There's a couple of things I would say that I've learned on the job that you can't really experience in school. Dealing with unhappy patients, you can never know how to do that until you experience it. Dealing with loss with a patient, something that you can't really learn about in school. It's tough to deal with. So those are things that you can't really prepare for or experience until it actually happens. Yeah. I love Idaho. I love Idaho because it's such a nice place with the mountains, the just trees, the nature that's around us. We've got a lot of wildlife. I love the people. Very friendly people. I think that you could walk down the street, smile, say hi to just about anyone, and start up a conversation, and they'll smile and say hi right back to you. So I love the outdoors, and we have that here. We have access to rivers, to mountains, mountain biking, hunting, and the people just in general really good, down to earth, and very friendly people. My favorite Idaho activity is basically just hopping in a car or truck or motorcycle or side-by-side or four-wheeler or whatever you want, and just going up into the hills and just exploring, finding new areas. There's mines that are available to go out and hike to and visit. Old abandoned gold mines, silver mines, places that you can see and just like learn a little bit of history of the area and how people used to live, and you know, where the pioneers came and settled. So my favorite activity is just get out and go exploring. My favorite sports team locally, of course, is the Boise State Broncos. Go Broncos! And that's the favorite. I guess my favorite health practice for myself really is to try to take care of my skin when I'm outside. Didn't do it very well when I was younger as a child. You know, I got a sunburn here and there, but now I'm pretty good about wearing a hat when I need to if I'm out, wide-brimmed hat, sunscreen on the sun-exposed areas, and just trying to protect my skin that way. I have had a skin cancer myself. I had a basal cell skin cancer removed by one of our Mohs surgeons here back in 2016. I thought I was too young to get skin cancer, but you're never too young, unfortunately. And so that experience just kind of helped me recognize that even though I felt young and I consider myself still kind of young, it's never too early to take those precautions to take care of your skin, do the protection that you need to, and watch for any changes.
What advice would you give yourself at age 15?
Oh, if I could give myself, my 15-year-old self advice, I would be a long chat. But I would say most importantly is don't sweat the little things in life. There's so many things that you could worry about that you really don't need to, that really make no difference in the long run. So just relax, don't sweat the small stuff, focus on kind of the eternal perspective, the long-term things that really matter the most. If I wasn't a dermatologist or a dermatology PA, I would really love to just go out and build things, whether it be homes or even just, I don't know, simple things like an awesome tree fort. I would just love to go out and build things and have fun doing that. The very first job that I remember having as a teenager that I actually received a paycheck and had to pay taxes on was a cider press out in Emmett at one of the orchards out there. It was not glamorous work by any means, but I learned that, you know, you check in and check out, you got to be reliable because somebody's counting on you to show up and do the job. I had fun interacting with my coworkers, so I learned a lot that you know, interaction and having friends during work can really make the day much better, and work go a lot faster. So my first job at a cider press out in Emmett kind of just taught me kind of the basics of you know, being a good worker. I guess if I had to describe myself in one word, I would say genuine. I guess try to be genuine. So a caution with treating warts at home would be maybe if you're getting a little too aggressive with the therapy, the freezing home remedies that you have can sometimes cause blisters and if you're blistering or freezing too hard, then that's going to lead to scarring. So if you're using any of the home remedies that include the freezing, and I wouldn't use dry ice, because dry ice you can't control very well. You're more apt to form scars if you're treating those too aggressively. So some people tend to be a little bit more prone to ingrown hairs. So if you have curly hair and darker skin types, so African Americans do have a higher incidence of ingrown hairs. A couple of things when you're shaving, if you do shave, make sure you're using a good razor every time. And you want to shave with the direction of the grain of the hair. So for example, if your hair here on the neckline is kind of growing down this way, you don't want to be tugging and pulling up when you're shaving. You want to go with the direction of the hair. Always use a sharp razor. Always use a good shave cream or gel. Don't do a dry shave. Use warm water because it relaxes these tiny muscles around the hairs, and that's going to decrease some of the irritation that can occur. And then generally I would have patients also do a antibacterial wash, like a little salicylic acid acne wash or benzoyl peroxide acne wash, to kind of decrease some of the bacteria. And you can do that before or after you shave. And then for those who are more prone to ingrown hairs, after you shave, those first couple of days after you shave, when you're washing, you can gently take a washcloth and wash in a circular motion to help to decrease those hairs from kind of curving into the skin. If you do that circular motion, it kind of helps keep them out and growing the right direction.